our drugs we import. And the alarm that I'm sounding now, that I'm going to sound now, is alarm that everybody should take home, walk away with from here. That we have drug insecurity. With coronavirus, India is already feeling it because they buy most of their materials, active ingredients from China. We import almost everything. So it's a scary thing, and I've been emphasizing this from day one. Drug security, we need it. When we import 70% of our drugs, we are in trouble if something happens.
Sunrise Daily continues about now with the team in Lagos with that topic on the alarm raised by NAFDAC. Chamberlain.
Well, yes, indeed, and it's one that concerns or should concern everybody. We've got Mr. Sam Ohaboma here with us. He is the president, Pharmaceutical Society of Nigeria. Good morning, sir. Thank you for coming on this morning. Well, when the DG of NAFDAC says drug security, we need it, saying that we import about 70 or over 70% of our drugs from China, that should get everyone concerned. But what does that mean in practical terms, given what's happening in China at the moment?
Well, it is that we have, unfortunately, a country that, sometimes we seem to be like we're either the deaf or the dumb. So I don't know who is talking to the other, because these alarms had been raised in the past. I recollect that in 2017, the Pharmaceutical Society of Nigeria had a conference in Umuahia, and the subject was bringing attention to the danger of the security danger, national security implications of being import dependent.
So what stalled it?
It is lack of ability to execute plans and the disjointed management of our economy.
So the concern when you mention shortages is the fact that, nature harbors a vacuum.
Yeah.
So if there's a shortage, people are wondering, wouldn't that be a window for counterfeits and what have you? Is that a concern for you?
A big concern, because the moment there is some vacuum, nature will fill it up. So, and if we have a country where already the industry, in normal temperatures, we say, and pressure, there's pressure from counterfeit and falsified medicines in the nation, coming into the country. NAFDAC is doing its best to prevent that. But then we have borders that cannot even prevent human beings from crossing with AK-47. So I wonder how such borders can stop pharmaceuticals which can be hidden. And it's worse in medicines, because medicine is a necessity. Right. So it's not a discretionary thing. When somebody is sick, he needs medicine, and we're paying out of pocket. He walks into the pharmacy or into the pet medicine shop, wherever, or into the moving truck, or into the open market, drugs are sold everywhere.
That shouldn't be the case.
But they are being sold. We have enforcement. We have police, we have army, we have NAFDAC, we have civil defense, we have security organizations. But go to the market, the drugs are there. Is it me that will go and take them out of the market?
Are you then indicating that there is some lacuna among the enforcement agencies? Of course, we know there is a National Drug Law Enforcement Agencies, there is the NAFDAC and agencies like that. There is, from what you are suggesting now, there seems to be lack of coordination among them?
Not only lack of coordination, lack of capacity. Take NAFDAC and Pharmacists Council of Nigeria. They don't have the capacity in terms of manning and resources to go and carry out a raid in a market. Involves going to bring police, going to bring army. Who will pay for them? The Pharmacists Council of Nigeria. The army is not going to come, the police will not come until somebody pays them to come and do their work.
Whoa. Oh, wow.
That's Nigeria for you. Nobody does his work until he's bribed. National Assembly will do their work until somebody motivates them. The executive will do their work until they have a benefit. It is the truth in the country, and we must tell the truth. Until we're angry enough to change this nation, we will be going through this. We will become elements that can be predated on by any nation, by any circumstance, because we are a country that makes rules. I do not implement rules, equip the rules.
Where did they get those drugs from? That the ones they gave without you going to the pharmacy?
The drugs that you get, they are got from the market. Go to Dumota, you see where drugs are sold. Go to Kano, you see where drugs. Go to Aba, go to Ariara, go to Headbridge. Drugs are sold in Nigeria in illegal places. And that's what I'm saying. Let's even clean up. If we can get that on, that stop that drugs being sold in illegal premises, you will have solved 60 or 70% of the problem. They will now sit and say, okay, between the levels of the people who are authorized, who does what and who does not do what. That is the way I think we will solve the problem. Okay. Trying to solve all of them at one go will be suboptimal.
All right, fine place to let it go. Mr. Sam Ohabonwa is the president, Pharmaceutical Society of Nigeria. Thank you for your time this morning.
What will happen if you call me Mazi Sam?
Nothing just happened.
That's just what I love to
You just did it.
That's what I like to answer.
Welcome back to this edition of Africa Dialogues brought to you by Philips. On this edition, we are focusing on counterfeit products in West Africa, and we have a very lively panel giving us some perspective from agents of government and, of course, the private sector. And before we move on, let's just get a feel of what we're talking about here, counterfeit products. We have quite a few on the table right now. And Chima, I'll allow you to talk us through some of what we're seeing here and the challenge that we're facing in Nigeria today.
Thanks. It's a very serious challenge, and this is why we need the support from all the regulatory bodies. But let me just throw this test, which would you say is counterfeit, which would you say is original?
All right, I'll allow Muda to go first. You're in the market and you have to pick. Which one will you pick?
I pick this.
This is the
all
original.
Right? You think that's original? Okay.
It's the original.
All right.
I want to inspect more closely.
You'll need to inspect quickly.
This should be the original.
All right, so we have two for the
for the clearer
one and the other.
This is the danger, and it's a very serious matter, because indeed this is the original.
Okay.
Yes. The reason why this is the original, because as far as 2008, the FDA had banned a material BPA. And it's been banned in the in most European, in fact all European countries, European Union, in Canada, in America. Now this BPA is a very harmful substance that is in plastic, and that is the substance, that's the material that makes plastic clear.
Right.
And this is toxin, and it mixes with the food, with the baby milk, and what your baby will be drinking is this BPA material. Now you see, which is in the clearer one.
Yeah.
And you can see with the plastic.
Right.
So this is so important, and we need to really address it together. I do understand when you say that the multinationals the brand owners need to work on it, but we can't do it alone.
Right.
We cannot do it alone, and we need the support of the regulatory bodies.
Let's talk a bit about some of the deterrents, and I want to bring Mena in here. Mena, how do we resolve this issue? Earlier you mentioned that the laws are there, so really the deterrence should be there. But what's the issue now? Is it enforcement? Is it capacity? Where do you think we're lacking here?